Hi, I'm Dr. Gelb. I'm the director of the Gelb Center in New York City, and I'd like to talk to you today about a subject that's we're seeing more and more, and that's insomnia and anxiety. Now, why is it I am, as a dentist, talking to you today about insomnia and anxiety? When you don't breathe well at night, so in other words, what I say is I take a picture of your airway when you come in on the first visit. It's a very low radiation scan, where I see, and sometimes I see a tiny airway even in very, very thin women and thin men. So the equivalent of how would you sleep all night if you were being suffocated or strangled? Well, I would have a lot of anxiety. And they've done studies with people that had no fear, they had no amygdala, and when they simulated that they couldn't breathe, these people had fear and anxiety for the first time. When we open the airway, the anxiety goes away. And sometimes we work with a cognitive behavioral therapist, but very often just by opening the airway, we take the hands off the neck, the anxiety, no medication, the anxiety gets better. It's like Levine talks about being chased by a tiger. If you were being chased by a tiger, you would have anxiety. So we're taking the tiger out of the room. The other thing we see is insomnia. So what I say to my patients, why would you want to go to sleep if you knew you were going to get choked? Why would you want to go to sleep if you knew you were going to get less oxygen, if you knew you were going to have disturbed sleep? So the body's basically saying, don't go to sleep because you're going to be deprived of oxygen. So insomnia in some respects is a defense mechanism. It's a survival instinct. When we take the hands off the neck, insomnia gets better. Now we work with cognitive behavioral therapists like Ross Levin, who specializes in insomnia, and what he does is he works with the patient, limits their time in bed, and improves their insomnia. And says, you know what, it's okay, you don't have to have insomnia. So it's not just falling asleep, it's allowing the patient to stay asleep for 6 hours at a time.